Hello, everyone. Alrighty, we're going to go ahead and get started. First, I want to welcome everyone to the second live webinar presentation of the 2022 Hidalgo County Employee Wellness Fair. I will be starting off this webinar with a sound check. If you can hear me clearly, please click the raised hand icon. Again, if you can hear me clearly, please click the raised hand icon. Perfect. Awesome. Thank you so much. So our speaker today is Dr. Alvaro Donaire Garcia from South Texas Health Systems. Born in Tegucigalpa, Honduras, Dr. Garcia attended medical school in the National Autonomous University of Honduras. He completed 3 years of pediatric residency in Lincoln Medical Center in South Bronx, New York City, and was chief resident of pediatrics at Lincoln Medical Center as well. Dr. Garcia completed 3 years of pediatric critical care training at Cleveland Clinic Children's Hospital in Cleveland, Ohio. He is currently the staff physician in pediatric critical care at South Texas Health Systems Children's Hospital. Thank you so much for joining us, Dr. Garcia.
Sure. Good morning. How are you?
Good. Thank you. I'm going to go ahead and stop sharing my screen so you have access.
Okay. Can you see my screen?
Yes, we can see your screen.
Okay, so good afternoon. Thank you for the introduction. As we were talking, I'm going to be talking this morning about the connection between asthma and allergies. As it was said, I'm a pediatric critical care attending at South Texas Health System Children. So, okay, get on the next slide. Okay, so the objectives of the talk are going to be to define what are allergies, allergens, and asthma. We're going to discuss the most common allergens that we have in Texas, and we're going to describe the signs and symptoms of asthma and the common treatments used both on asthma and allergies. So in order to understand the whole discussion, right, we have to clearly define each term that we're using here. So what is an allergy? So, you know, Googling through the internet, you see different definitions. Both of them are this from well-known dictionaries. The first answer I found is that an allergy is a reaction by your immune system to something that does not bother most other people. The second definition I found was an exaggerated or pathological immunological reaction to substances, situations, physical states that are without comparable effect on the average individual. Okay, so the importance of the definition of allergy is that not everyone is going to have it, and some people are going to overreact more than others. Okay, those are the two key factors here with the definition of allergy. Okay, so in order to have an allergy, we have to understand what are allergens. So allergens are substances that can cause an allergic reaction. Okay, and we've heard about several common allergens, right? So once again, allergens are the substances that cause those allergic reactions. So we have pollen, we have latex, we have mold, pet dander, dust mites, insect stings. We have fumes, you know, even pollution can be one of the many allergens that cause allergies. Okay, so far we've defined what's allergy and what's allergens, and we understand clearly what they imply. So having clear what both of those terms are, the question is, what is an allergic reaction, right? So an allergic reaction pretty much is the interaction of the body with this allergen. So the allergen, which is any of the substances we spoke, it could be pollen, it can be dust mites, it can be pet dander. Any of these allergens activates the immune system, okay? So in order to develop an allergic reaction, the body needs to be exposed twice to that allergen, okay? The first time, which is the time it develops immunoglobulins or antibodies, and the second time that it's when the body releases these antibodies, okay? In the left side, we can see here a little bit of a diagram of the most important cell. Okay, so the immunoglobulin is released an antibody called IgE. And this IgE causes the release from one of the cells called the mast cells. It causes release of of many substances. Probably the most important substance you know is histamine, okay? And we hear about antihistamines all the time, right? Whenever you go to CVS, Walgreens, you see in the aisle antihistaminics, right? It's probably one of the medications that's more well known and that it's sold most in the United States. So, so what does histamine do? So once histamine is released by these cells, it affects the lungs, the throat, the sinuses, the ears, the lining of the stomach, and the skin, okay? So we see an allergen causes an allergic reaction, and this allergic reaction can have a widespread amount of symptoms throughout the organism, right? Okay, so allergies, what is probably the symptom that we most commonly think of? Runny nose. We think about a rash, which is any type of redness, irritation, or inflammation of the skin. We suddenly feel that kind of, you know, a scratchy feel or a little bit of a tickle in the throat, which causes us to cough. People can also have vomiting, inflammation of the skin, and the watery of the eyes, right? All of us at some point have had some sort of reaction like this. So, you know, everyone is always thinking about the allergy season, even more those people, right, that have allergies, right? I would say that probably 20–30% of the population have an extent of some sort of allergy, right? So Texas has a very interesting allergy profile, right? Even more the valley, right? Because it almost feels that we have a very extended warm temperatures. We really don't have snow or a freezing winter. So there's a lot of things that are, you know, lingering in the air. So just kind of like some funny memes of how people always get nervous about, you know, allergies. We see here in the left upper corner this very popular meme in which let's open all the windows, right? And Batman, of course, saying like, no, it's allergy season, right? Or those who are allergic are always like bracing themselves, getting their medications ready because allergy season is coming. And we see down there Snow White too, you know, outdoors with the bird, her eyes are red. And we can see all the Kleenex from all the secretions she probably has, right? And then the other big thing with allergies, right? Are you sick from a virus? Are you sick from COVID? Or is it just allergies, right? So many people during this pandemic have been trying to even more control their symptoms or have thought many times, do I have COVID or not? Because allergies act and produce very similar symptoms. So when I was talking about Texas, how Texas has a very interesting seasonal allergens, this is a calendar from month to month in which we see probably the most common allergens. And remember, allergen is a substance that can produce an allergy, right? So Texas is a really beautiful state, many trees, you know, there's grass everywhere. And all of this, you know, all of this, probably every single tree can cause to an extent allergies. So as we can see, as I was telling you, that there's some allergens that just linger throughout the year. So someone can have allergies throughout the year. As we can see in the graph, mold and grasses are probably affecting almost all the entire year. And then we have some specific, you know, trees that can affect as well. So because of this, because we have such a widespread different type of, you know, herbs and trees and grasses that can affect, people very commonly can have allergy symptoms at any time of the year. Okay. So kind of putting together the concept of allergies and asthma. It's very frequent thought, right, that allergies, when we speak as a whole of allergies, it can include multiple different conditions, okay? So one of those conditions is conjunctivitis, right? In which we have irritation of the eyes, we have redness of the eyes, watery eyes. We have specific medications to control conjunctivitis. We have rhinitis, which is inflammation, right, of the linen inside of the nose that produces There's inability to breathe through the nose and a continuous runny nose, swelling. We even see that people have swollen eyes from all the accumulation of the secretion. We have another very common, allergy manifestation, that is eczema. Okay, eczema is, in the big scheme of things, is any inflammation or irritation of the skin. So it can go, from very little round lesions in the, elbows, hands, face, to a widespread throughout the body. So another not too popular, but eosinophilic esophagitis is an allergic manifestation of the esophagus, in which people with allergies have a lot of trouble swallowing, okay? Or they can even have impacted food because of the reaction that happens inside the esophagus. Food allergies too, people that are allergic to food, specific, we see these very commonly in the kids. Some kids may have allergies to egg or other substances, and these patients can have vomiting, diarrhea, or even eczema too. And last but not least, asthma. So asthma is such a, well-known, popular condition that we're going to speak a little bit more as we kind of put together all this term. So I want to see how, you see all these conditions, all these different manifestations can be present on the same person, right? Unfortunately, it's a lot, right? But, sometimes some people just have a couple of manifestations: asthma, conjunctivitis, asthma, rhinitis, eczema, food allergy. And something, at least in my field, which as I was saying, I'm a pediatrician, many times we see that the kids that have eczema, that have rhinitis, all of these kids are going to be prone to have in the future asthma, right? So it's always one of those, red flags or things that the people always have to be following, because any type of allergic manifestation can have any of these presentations, right? And so putting everything together, bringing all these allergies into asthma specifically, why is asthma an important condition to know? Because as they sent in the introduction email, asthma affects a significant amount of the population, okay? Asthma affects more than 25 million Americans, which is approximately anywhere from between 7 to 8% of the population, okay? So any given time that you're in a room with 10, 15 people, 1 or 2 are going to be asthmatics. And we commonly see people, right? They carry their inhaler. They may have a little bit of symptoms here and there. In schools, there's always 2 or 3 kids per class that have their inhalers. And that's because asthma is such a common and prevalent condition, okay? Of course, in multiple evaluations of asthma, the most recent in 2017, it was reviewed that asthma resulted in 1.6 million emergency department visits and 183,000 hospitalizations in the United States, okay? And probably the most important point of asthma is, aside from, causing symptoms, causing distress, is that asthma is a condition that can kill, right? So the mortality rate of asthma is that for every 1 million people that have asthma, 10 can die. So on average, every year we have 250 to 300 people dying from asthma in the United States, okay? That rate is higher among adults than among children, okay? So it's a condition that, can really have a toll. So kind of understanding by systems and by organs what asthma is. So asthma, as we were seeing how the allergies affect multiple organs, right? Asthma is specifically a condition that affects the lungs, okay? And what do the lungs do, okay? The lungs are the organ that carries the breathing process, okay? And what does breathing mean? It means exchanging carbon dioxide for oxygen, right? Oxygen is the primary fuel of our body. Every cell depends on oxygen to produce energy and carry their day-to-day functions, okay? So asthma, and what do we see in asthma? We see in asthma the lungs, there's a narrowing and inflammation and production of extra mucus, okay? So all of those cells that cause allergies activate, they release all these immunoglobulins, and then they produce release of histamine, and then we have inflammation of the bronchi, we have extra mucus, and what happens? This causes the feeling of that you're having a breathing difficulty, right? Normally, what would be 1 centimeter big, it narrows up to one fourth of it. So our airways, whenever we have an asthma attack, they narrow significantly. And what happens when they narrow? You have cough, you have wheezing, that it's like a whistling sound that sometimes you can just listen from the distance. And we have shortness of breath, right? Because the body feels that they cannot receive the oxygen that it needs. So of course, the body compensates by breathing faster. So with asthma, unfortunately is not a condition that can be cured, but the symptoms can be controlled. And in some cases, even more with asthma that presents in very early in infancy, in some cases it can be outgrown. Of course, the million-dollar question is why some people have asthma, why other people don't. Unfortunately, scientists and doctors throughout the world haven't yet found out why, but we're working hard, right, to determine what genes are affected, but we can clearly know, right? If you have a parent that have asthma, a brother that have asthma, most likely you have the odds of having asthma or any other allergic manifestation. Okay, so asthma can present at different onsets. It can have different presentations. So usually childhood asthma starts before age 5, and this is the one that you usually outgrow. Adult onset usually happens after 18 years, okay? The interesting thing with allergies, right, is that sometimes you have people that have lived in the north all of their life, and if anything have had like mild symptoms, right? And then they come down to Texas and boom, they have they start developing trouble breathing, conjunctivitis, and some of the allergic manifestations. So it's funny because Austin, a little bit north from us, sometimes has been called the allergy capital of the United States, but it's just because of this widespread of, Texas has such a varied weather that we have so many allergens present. So you can develop theoretically asthma at any point if you're sensitized to a specific allergen. So what's the critical part of having asthma? Yeah, you can have the diagnosis, you can be breathing comfortably, but when you have an asthma attack, which is when you develop, this worsening symptoms, 3 things happen. And we very commonly hear the word bronchospasm, right? And this is around the bronchi, we have muscles. So those muscles contract, okay, because of the release of histamine and other substances. So this narrows the airway. Then inside, you have inflammation, okay? The histamine causes vasodilation and leakiness from the vessels, and this produces even worsening narrowing of the airway. And last but not least is an increased mucus production. So pretty much the bronchi narrows from outside, narrows from inside, and on top of that, you have cells that start producing more mucus because of this overstimulation, right? So it's a trifecta that can seriously affect the airway. I think it's always very interesting and dramatic when you see the picture of how the bronchus look versus a normal bronchus on the right versus an affected bronchus with asthma. So remember, we were talking about the lungs. Inside of the lungs, we have these breathing tubes that are called the bronchus, right? They pretty much start here in the throat and they start dividing throughout the system. So we have multiple of this. So as I was describing you, these round fibers around the bronchi start tightening, they narrow. Then if you compare this inner linen of the bronchus, you see how it gets thick in here, and then we have all this yuckiness of mucus, okay? So it can get really bad in no time if you don't treat it aggressively, right? And, unlike other situations like a pneumonia or any other type of infection, this can set within minutes to hours. Okay, so that's why being exposed to an allergen or not being treated or not being prepared for asthma, it can happen anytime, and the lungs can really close in no time. As you can see, like the narrowing is impressive. I always find quite impressive when we have this type of illustrations. So with all that description of what happens and how, this breathing pipes get narrow, we have shortness of breath, which is that inability of, like, you try to take a really deep breath and no air comes in because of the obstruction. You feel that chest tightness, the lungs, start expanding, and that kind of causes that discomfort. Given that the air has resistance to come out, you can hear the wheezing. Of course, people that have an asthma attack while they're asleep, they suddenly wake up with this inability to take breaths, or they wake up coughing or with wheezing. They try to cough out the secretions to improve, the air movement. And unfortunately, many times viruses can also trigger worsening symptoms. Okay, so you already have an organ that is very sensitive, right? That's already at baseline, it has some inflammation, and then boom, you have a virus, and the virus can also worsen any asthma attack. And we commonly see this with the common cold or the flu, and even more in pediatric populations with other viruses like RSV, like adenovirus. So, patients with asthma have to be treated fast, aggressively, and most of all, you have to think always about prevention, and we'll talk about that. So as we were speaking before about allergies, 50 to 70% of the patients that have asthma have allergic asthma, and the most common allergens are molds, pollens, and pet dander. And the unfortunately, pet dander is one of those things, right? That pets can be cute, but sometimes cat dander is like causes an asthma attack in no time. So unfortunately, sometimes some parents are unable to have pets at home because of the dander itself. And there's other non-allergic possibilities of having asthma or having an asthma attack, and this happens with exercise, stress, or even changes in weather. So, but this non-allergic is usually a smaller percentage, less than a quarter of the patients. So, asthma, of course, there are people that just use an inhaler every now and then you have people that have to take medications every day, right? So that divides asthma into two groups. The group that has intermittent symptoms, which is the ones that comes and goes, and when they can have an attack every now and then, but they have no symptoms in between. And then we have the group with persistent asthma, that people have symptoms most of the time, okay? And these people can have severe limitation of activity, okay? And these, unfortunately, are the ones that tend to may die. The ones that are undertreated have daily symptoms, and then they have an asthma attack. So the airway is already narrow, and then with an attack, boom, they just go into a full bronchoconstriction, and there's no air entry. So once you identify the asthma severity, and how do we define the asthma severity? As we were talking, right, about the frequency of the symptoms. So for asthma, we have like 4 big categories, which it's not too important for this conversation, but based on the frequency of the symptoms, we define what is the medications that you're going to use. Okay. So, and this is something that it's commonly discussed with parents, and sometimes, there's a little bit of a complexity of understanding, right? A patient with asthma should never have daily symptoms. A patient with asthma that's appropriately treated should be well controlled, should have a good quality of life. We have many athletes that have asthma and they still play sports because they're well treated, right? So, and unfortunately, here down in the valley, we see that with obesity, allergies, and asthma, all takes you into a downward spiral of limitation of activity and worsen obesity. So it's very tricky. But if you reach your diagnosis, the severity of your symptoms, and then the appropriate treatment is started, the quality of life should be good. Okay. So as I was saying, the way we classify, if you have symptoms less than 2 times a week, if you have symptoms, more than 2 times a week, but not daily, if you have symptoms daily, or if you have severe symptoms, which is multiple times through the day. So the easiest question we can do to someone to know how severe their asthma is how many times do you use your albuterol pump during the day? Okay. And if the albuterol pump is always in the drawer and never used, you're like, okay, you have peace of mind. It's something that's well controlled. But if you have someone who says, oh no, I use a pump, I ran it over a week or two, and it usually has 200 doses. So those are the patients that you're concerned that can get sick very fast. Okay. So in the asthma treatment, we have like 2 big families of medications we use. One are the bronchodilators that are very popular, and this is albuterol. That's our main bronchodilator. There's other medication called Atrovent that we use as well, but not as popular as albuterol. And then we have anti-inflammatory medications. Okay. With the anti-inflammatory medications, we're talking about steroids. Okay. And steroids in asthma can be inhaled, or it can be oral. Okay. Of course, steroids, and I think all of us have always heard about how many side effects steroids can have. And yes, they can. Luckily, when we use inhaled steroids, their side effects tend to be not as bad as the ones when we're taking oral. Okay. There are other families of medications we use that are triggered more towards preventing, right? So steroids are designed to prevent the inflammation inside of the airway. Okay. And there are other medications that also prevent the release of immunoglobulin E, the release of histamine. So every patient, you tailor their treatment according to their symptoms. But the important thing to know is that we have many treatment schemes that we can use for the patients, even the ones that have severe asthma. So as I was saying, based on the severity of the symptoms, as physicians, we have a stepwise approach of what medications to use. Okay. And we commonly try to treat the asthma and any other allergic indication, right? Or any other, as we spoke, conjunctivitis, eczema. So and there's a stepwise approach based on the symptoms. And this is the most recent 2020 guideline. So as I was saying, every day we're trying to bring up new medications that maybe are not to focus on controlling the asthma attack, but preventing the changes of the airway, which at the end are going to improve the quality and decrease the frequency of the symptoms. So aside from the treatments we use on asthma, whenever we have, we only have allergies from our nose, rhinitis, conjunctivitis, we tend to use antihistamines. We tend to use steroids as well, in which we have the very typical and popular Flonase, that it's the one we can spray in our nose. We can use decongestants, which is pseudoephedrine. That's probably the most common one. And in the patients that have a condition that's called anaphylaxis, that is a type of allergy in which the symptoms are 10 or 20 times worse, these patients tend to need use epinephrine. Okay. And this is the popular EpiPen that people with history of anaphylaxis have to carry in their backpack and their purse. Okay. Because airway, at the end, whenever you have an allergic reaction or an anaphylactic reaction, your biggest concern is that your lungs are going to close up from the allergic reaction. So aside from the medications, right, it's very important to try to have prevention, right? So avoiding triggers and be compliant to the medication is fundamental. But it gets tricky here in Texas, right? With as we were saying, with so many specific trees and grasses that can cause symptoms, right? And there's where you go specifically to an allergy doctor, and you can get tested for every single substance. And that's the cool stuff we have nowadays. You can have an allergy test, not the ones they sell online. Those ones are not very accurate. The ones you have to go to the allergy clinic, and they specifically do a pinprick test in which they inoculate little amounts of all these allergens, and they see to which substances you're allergic. This is a fantastic test to have. Also, we have some blood tests in labs that we can use as well. As I said, the ones you buy online, they're still not very well, because they can show you that you're allergic to stuff that you're not really allergic, or they can miss stuff that you're allergic. So, and the reason is, if you have a very specific allergy to ragweed, for example, they can allergists can specifically tailor immunotherapy for that. Okay, and it can kind of help you in the long run. So because I do have a colleague that in her first house she was okay, and then she moved to another house and she had, I believe it was a ragweed, and boom, she had allergy symptoms all the time she went out of her house. So you have to be aware what causes the allergy, and the best way is to get treated, right? Because you're not only going to have the symptoms, but you're prone to have really, really severe anaphylaxis and even an asthma attack. So the conclusions of the talk, right? Allergies and asthma are two conditions that are very close together. And we see that it's not only asthma, right? It's conjunctivitis, it's eczema, it's food allergies, it's asthma, it's eosinophilic esophagitis. So there are many conditions, and sometimes we use the term atopy for the patients that have all this many clinical implications. And so allergies and asthma tend to go very close together. So Texas is also a region with many potential allergens, right? So that's where we need to tailor our treatments and be aware of what we're allergic to. And last but not least, asthma is a complex condition that if left untreated is lethal. So here is the importance of, you have asthma, you're having daily symptoms. That means you're not treating it well. That means you need to go to your doctor, step up on your treatment, because people with asthma should have a good quality of life, should be able to play sports. And not only that, if they develop a severe asthma attack, they can die. So thank you so much. Here we see a poor puppy that's about to sneeze. So that's all I have for you guys.
Thank you so much, Dr. Garcia, for your very, very informative presentation. I'm going to go ahead and open up the presentation to our audience for a Q&A. We already do have quite a few questions coming in. I'm going to go ahead and share my screen with this other. There we go. Okay, so let me look up some of the questions that we have. So I know you did discuss this a little bit, but can an allergy be developed in adulthood, but maybe particularly an allergy to certain foods?
Yeah, it's a little bit more unlikely to develop allergies to specific foods a little bit later, but of course, if you are exposed to something new, right, to something you haven't eaten before, a new spice, you can definitely have then develop food allergies.
Okay, awesome. Another great question. In absence of an inhaler, is there anything bystanders can do for someone experiencing an asthma attack after calling for medical attention or 911? Are there types of non-medical facilities that usually have a kit or procedure in these cases? Or I guess maybe like more of what can a bystander do in this situation?
I think, as you said, activating your response system, which would be the first thing, calling an ambulance. I think that, trying to keep a situation relaxed, right? If we normally say if a kid is having an asthma exacerbation, we need the parents to kind of, be next to them, relax, and avoid further anxiety on the kid or the patient itself, right? But it's very easy to say, but if you're having shortness of breath, okay, it's a very dramatic situation. So unfortunately, aside from medications, either injected or inhaled, there's nothing you can do in the short term, okay? And it's funny because reviewing some of the papers with asthma, the most common intervention people tend to do when someone is having an asthma attack is offering a glass of water, and a glass of water has absolutely no effects. But it was interesting because it was brought up by this. The only maybe exception would be in a school in which a kid already has a diagnosis of asthma. Maybe there's no inhaler, but they have prednisone. They have like an oral steroid, and prednisone. If you have a pill of prednisone, that actually can help with the asthma attack, in not in an immediate sense, but maybe within minutes.
Okay, awesome. Yeah, no, there's some great tips. Thank you so much. Somebody asked, how often are you supposed to change allergy medication brands?
Um, so I guess it all goes towards the stepwise approach, and towards control of symptoms and identification of what you're allergic to. I think that we have specific dosing. For example, for loratadine or Zyrtec, both those medications that we use for allergies. Some people would recommend sometimes even using both of them. But at the end, if you don't have good control, you need to see if you can find additional, inhaled steroids or even other medications that prevent this attacks. Which one that it's very common is Singulair, which helps to decrease the amount of cells that tend to cause the symptoms. So it all goes, it all goes to seeking for attention and making sure because what if you're allergic to a cat, and you just brought a new cat home, and you were never aware of it, you've never took clothes, and then boom, the cat comes and you're miserable, right? So unfortunately, it would be control of the source in that sense.
Okay, awesome. Thank you. Sorry, excuse the background noise. So somebody does also ask, does asthma limit exercise activity? I know you kind of touched on that previously.
Yeah, so cold air and sometimes changes in the humidity can induce bronchospasm. So whenever we have a patient who's diagnosed with asthma, one of the common things and one of the common instructions is to use albuterol 15-20 minutes before exercising to decrease the possibility of having the symptoms. Albuterol commonly is used as a control, as a medication when you have symptoms, but in the case of someone who's preparing to do exercise, they have to use the medication 10-15 minutes before, and that tends to control any symptoms from exercise.
Okay, awesome. Let me see another one. Thankfully, we do have quite a few questions coming in, so that's great. I know somebody was asking about eye drops and allergies. If there's kind of, somebody was saying that their eye drops can make their eyes dry out more. Is there a specific type of eye drop maybe for allergies that would be better than another? And I know obviously you can't specifically prescribe anything, but just in general, I would say, are eye drops something that maybe people should be using more often?
So unfortunately, when we use antihistaminics, one of the side effects is dry eyes, dry mouth. So it helps our symptoms, but as they say, they tend to generate dry eyes or mouth. So what we commonly recommend is using natural tears, or those are over-the-counter medications. Even more when we're using more frequency of these medications, and kind of going back to when they were asking about the allergy medications and the antihistamines. It's important to remember that we have the medications that you can use once a day, and then the medications you can use every 6 hours, right? So the more you use a medication that causes, removal of histamine, the drier your mouth, your eyes are going to be. So that's unfortunately one of the reactions of the medication.
Right. Okay, thank you. We'll just do one more question. So in regards to COVID, does someone with asthma have to do anything specific to help with symptoms? We know that COVID has definitely, I'm sure, exacerbated some people's asthma symptoms. So is there anything maybe specific that they could do to help with that?
So, if you're asthmatic and you're diagnosed with COVID, everything is going to go back to the symptoms, right? It all depends on the risk factors you have. But if you have, if you're older, have obesity, have diabetes, and are positive COVID and start feeling some asthma symptoms with it, the most important thing is, go to the hospital, because you can even start biological treatment to prevent any further progression from the COVID. Because, once you're positive, you can really have severe symptoms, and we don't really have anything over the counter for COVID treatment, right? So, but we have a lot of, medications in hospital that we can use, and if you feel bad, come to the hospital, because things can get bad in no time. I think you're muted right now.
Thank you so much. We did have one more question that came in. Are there specific medications that can be used to help with nausea caused by allergies? Which I was very surprised, because I didn't even know that nausea was a symptom, or vomiting was a symptom of allergies. And that's because I'm a chronic allergy sufferer as well. But yeah, would you say the best thing to do maybe to visit with your physician?
It all goes to source control, right? So if your body is allergic to a specific food or something you eat, and you eat it, it really gets tricky there. Yeah, you can use some over-the-counter medication for nausea, but it's just like putting a band-aid on a scratch, right? So unfortunately, if you have an allergy to that specific food, you have to not consume it, right? So
Right.
because
Okay.
I've seen cases, oh, I'm allergic to shrimp, but I can eat half a shrimp. No, rash, runny nose,
Yeah.
trouble breathing, or even the broth of shrimp, for example. Like you didn't even eat the shrimp, but you drank some broth, you can have a full extent of symptoms. So,
Right.
yeah.
Okay. Okay, well, awesome. Well, thank you so much for your part, or thank you for Dr. Garcia for your really great presentation and for answering these questions. We really appreciate your time and everything. Thank you everyone for your participation. This concludes our second webinar of the 2022 Hidalgo County Employee Wellness Fair. Be sure to check out the rest of our online platform or join us in person at the Precinct 2 Indoor Sports Complex. If you have any questions, please message us through our chat feature through our virtual platform, or you can email us at hidalgocounty.wellness@co.hidalgo.tx.us. Thank you very much, everyone, and we'll see you very soon. Thank you, Dr. Garcia.